to seek help, and counselling is not only for people with mental health issues. It can be for everybody. Hi, my name is Stella. I'm the Executive Director of Bethesda CARE Centre, CARE for short. I have been in the counselling industry for at least 15 years formally. Okay, so as a counsellor, basically we see clients, we talk to them, find out what's the issue, and then we process with them what are the steps that they can take, and then to encourage them along the way. Okay, a typical counselling session will be about 45 to 60 minutes. Of course, the first session sometimes it may take more, like maybe 1.5 hours. Yeah, so that will be duration. How does the thing work is, so when client comes, so for the first time we will do a lot of note taking to understand more what's the issue, and then we'll try and find out, because sometimes clients will come with the issues they thought were the problem, but we know that we need to find out the root issue, and so we basically process with them, talk to them, find out what's really the root issue. And then again, like I said, it depends. If it's a one session thing, then we will find out a little bit more, then we will help them to see a certain area which they may not see. Yeah, and then after that, we will then maybe advise them on the different roads they can take, and even the basic steps, the practical steps that they can take to help them reach where they desire to. Okay, so again, we will check with them and understand whether is it a one-time. Of course, first of all, it also depends on the client. So let's say after talking to them, we feel that it's a process, maybe they need a few sessions to really get out of the state they are in, then we will actually let them know, and then the clients can then decide whether they want to come back, because there will be clients that they may not want to come back. So if the clients want to come back, then we will set the next stage. So basically, we'll let them know, estimate how many sessions, is it 4 sessions or 6 sessions, yeah, so that at least they know they are prepared. Yeah, then they'll make an appointment to see them. But let's say for clients that says that they are okay with it, they don't want to continue, then we will just end the session. After which, then they are free to call us if they want to make another. Okay, so at Bethesda CARE, we actually provide free counselling. Yeah, so one of the very, I don't know, so far I have yet to find another centre that offers free counselling. Okay, so let's say for a family service centre, they can charge maybe between $30 to $50 for a session. But again, not all family service centres do counselling. They may do case management, but not counselling. If you talk about private can cost anywhere from $100, $150 to even $300 per session, which is about 1 hour or 90 minutes. Counselling, so some people may think that counselling is, oh, I come here, you tell me what to do, and I get it done. But actually, counselling, we're actually helping clients sometimes to see what is actually the environment they are in. So I always, say that counselling is like, in front of you, you have this big ball, kind of a big ball which is all tangled up, and we're actually helping them to untangle it so that they can actually see what's ahead. So many a times the client is just in a state where they just cannot really see, so we actually help them to first of all understand their feelings, understand the situation they are in, and then to let them know what's the way they can get out from. That means sometimes there could be different paths they can take. We will then let them know the various paths. We will explain to them, when you take this, what will be the consequence, or if you take the other road, what's the consequence, and then to help them then reach a decision. Let's say they reach a decision which route they want to take, then we will give them some maybe practical tips, like I said, practical tips to help them how to walk through the path. So that's basically what counselling does, not so much as I tell you what to do, I give you instructions, but really is to guide you along the path, to help you clear your path a bit, you can see a bit clearer so that you can walk through. It varies. So some people may come for just one session and they are able to actually get out of the situation on their own. That means they just need certain tips, certain advice, and then they are able to go on their own. But there may be people who need so a typical one, maybe 4 to 6 sessions for some general issues. But then there'll be cases, especially if it's concerning mental health, It can take years for some clients, but the duration of seeing them should get shorter as to the interval should get longer. So maybe when we start, I could see you twice a week, and then after that once a week, and then once 2 weeks, once a month, and sometimes it's once every 3 months. So it should get the gap between each appointment should be longer as time goes by. But there are clients that actually we still see them after a few years. No, anybody can see counselling. Like I said, counselling doesn't mean that I have a mental issue or I had a sickness or whatever. But sometimes I may just be very, very stressed. It could be work issue, it could be family issue. And so when you talk to a counsellor, like I said, the counsellor will help you to understand your feelings, how to accept your feelings, how to manage. And then, and then that will be okay. So you basically don't need like professional diagnosis. As long as you feel that there's something bothering you, you can seek counselling. Basically, counselling therapy, it can be the same. So let's say like if it's a counselling that a counsellor uses a mode of therapy, a type of therapy to see you, that is considered a therapy. I could be counselling, I could be just talking to you, helping you to assess a situation. I may not really go deep into a lot of history and all that. Then it may just be considered a counselling session. But in a lot of sessions, usually we will like go into certain histories, we'll go a bit deeper, and that is considered a therapy. So basically, a counsellor who uses a particular type of therapy, it can be considered a therapist. Psychiatrist is actually a medical doctor. So this person already is a medical doctor first before they can become psychiatrists. And they are the only ones who can actually dispense medication. They are the only ones who can prescribe you medication. Not a psychologist, not a counsellor, not a therapist. Actually, you can just go to anyone if you're not sure. You can see a counsellor to tell the issues. So let's say for me, I'm a counsellor. If I talk to a client and I feel that this person may need some medication at the initial part to actually stabilize the condition, the mood and all that, then I'll actually refer this person to go and see a psychiatrist. So whoever you see, maybe a counsellor, a psychologist, a psychiatrist, they will be able to actually guide you as to, do you need anything else besides what you are seeking for? Yeah, so you don't have to like, okay, I must know what I want, that kind of thing. Unless if let's say somebody who you know that the mood is very, very unstable, then the advice will be go straight to see a psychiatrist because this person may need medication to stabilize the mood. Okay, so if you need a professional diagnosis, because if you talk about informal diagnosis, actually any counsellor or therapist can give you. But if you want a certified diagnosis, that means you need a paper maybe for work, for MC, whatever, then you need to see a psychologist or a psychiatrist. Like I said, we will be able to diagnose, but we cannot give you the certificate to say, okay, this is your diagnosis, and you cannot use it as a professional document, as a formal document for any purposes. Of course, if you see a counsellor is able to tell you maybe probably what's the issue and then help you along the way too. I think sometimes we do feel the client, but as we go along, after being a counsellor for a period of time, we actually learn how to actually differentiate between work and personal. So we must not take things personal. That means I have to tell myself first, I'm a counsellor, I'm not a savior. So what's the difference? Savior is like, okay, I'm here to change you completely until you're well, but I'm not. So I'm here to walk with you, to help you along. But I do know that, it's also dependent on you, not on me, whether you can get well or not. So firstly, we must understand that so that we do not get affected if a client doesn't seem to be improving. Then also, we also have to mentally prepare ourselves, after each session to go through right now, whatever, and then we must learn to park it aside and not like bring the issues home. Yeah, because basically when we see clients, it's all the different kind of problems. If we actually bring it home, then it would definitely affect us. So over time, I wouldn't say that I'm totally, immune to any feelings. I do feel, but I've learned not to let it affect my own personal life and thinkings and all that. Okay, so the clause we always give our clients, 3 clauses where we will break. Number 1, if the person is intending to take his or her own life. Number 2, if the person intends to harm somebody else. Or number 3, the person intends to damage certain property, like, I'm going to put a bomb here, that kind. So if any of these 3, we will then break confidentiality. So it's always made known to the counsellee right at the beginning of the first session. Okay, so if you talk about counselling, like I say, it's true that it can be quite expensive, especially if you're talking about going to private, because there's not a lot of accessible so-called government subsidized counselling sessions in Singapore. Unless you are warded in a hospital or you go to IMDA, then it may be subsidized. But otherwise, every session you go to, it can be anywhere in the hundreds kind. So it is definitely expensive. But let's say somebody who is first, or knows of somebody have mental issues, then this person should actually go to the A&E of IMH, which is then, it will be subsidized at the beginning. Yeah, but after that, if you're trying to seek treatment, seek counselling on your own, then it is definitely expensive. So we always work with the clients beginning a goal, an end state that they want to be, and along the way we will measure, has this person improved? Or let's say after 1 session, after 2 sessions, after 3 sessions, it's still status quo, it's still the same as the everything else remains unchanged. Then the session itself may not be effective. Well, number 1, it could be counsellors not doing a good job. But many a times, client may not be cooperating. That means, the steps you have to do, they are not taking those steps. Yeah, then it may not be an effective state. But anyone that, as long as there's any improvement, we always tell the client it's a process. As long as a little bit improvement, it is considered effective. Number 1, it could be stigma. To a lot of people is, see counsellor, does it mean I'm crazy? What will people ask? What will people think of me if they know that I'm seeking a counsellor? Yeah, so the stigma in society, number 1. Number 2 is they may not be aware where can they seek help from, are there places they can go to, who can they go to. Number 3, it could be fear that they are not sure how people, whoever they talk to, how will these people respond, will these people be sympathetic, or it will come across that they are useless or whatever. And then of course the last reason could be because of cost-wise. As long as you feel that you are facing certain struggles in your life, it's always good to seek help. Seek help, like I said, it doesn't mean that you have an issue, it just could be at a point in time you just need help to walk through. So it's okay to seek help, and counselling is not only for people with mental health issues, it can be for everybody. And anyway, government has come up with statistics that one in every 7, has in Singapore itself, has faced certain type of mental health conditions at certain point in time. So it is something that common that people go through stress. So it's okay if you cannot cope by yourself, it's good to seek help.